821, we're already 3 days into this latest hurricane season, and now is the time to make sure your loved ones are prepared in the event of a major storm. Homecare Solutions owner Diane Bozeman joins us now with some preparation tips. And I mean, it's nerve-wracking for anybody at any age. But when you talk about the elderly, Diane, it's especially, it brings on more anxiety, it seems like.
Exactly, and especially when you're talking about the frail elderly or elderly people who may have dementia or Alzheimer's disease, who are not really able to process what families are even trying to tell them to do. It can be very nerve-wracking. They can get very afraid. We did have our experience with Katrina, which just adds to a heightened anxiety. And but then you also have the other side of the coin, which is the elderly people who still are resistant in spite of what we went through, and they do not want to evacuate. They want to stay in their homes. We still have some elements of that we've seen even since Katrina with Isaac and Gustav. As much as we think everyone would want to leave, you know, we still deal with some people who want to stay.
I mean, there's a lot of stress involved because you have to pack up, you know, all the
Right.
important things in your life, and then you have to sit, you know, evacuation route, and you could be sitting there for hours, and that alone can make an elderly person nervous. What should families be thinking about now, just in case?
Right. I think right now the best thing that any family can do is to have a plan, as cliche as that sounds, to at least to be able to reassure the elderly person that you're going to be with us. Sometimes the older person might not need to know all the details, but the family needs to know. And what families need to think about is, with an elderly person, what do I need to take care of my mom or dad or my aunt or uncle or grandmother for a week? Do I know where the medication list is? Do I know who their physicians are? With smartphones, at least we can have all of that in our phone at our fingertips. But if you're going to be evacuating over a distance, the other things to be concerned about is where might medical care be along the way in case there is a crisis. For elderly people who are dependent in some ways, whether it's about dressing or bathing or their hygiene, their grooming, sometimes families may need to consider taking a caregiver with them, somebody that the elderly person may be familiar with who can help family members with those kind of details as well.
So it's good to maybe make that checklist now.
Right.
Have your plan. You don't have to go through every detail.
Right.
But let them know, look, you're going to be with us, you know, it's okay. And then also maybe pre-packing a little bag
Yes.
now, just in case.
Pre-pack a bag with the medications in it, with your water bottles, with snacks that a person may want, you know, just like we would do for our children in some ways. I mean, to make sure we have things that are usable and, you know, make sense to have along the way. And make sure they have medications. We've always heard take 2 weeks of medications with you. That requires a family to at least look and see when the next refills are. You don't want to leave when your refill is due tomorrow. I mean, get it 3 days before.
These are some great tips, and if you need any more information, Diane Bozeman is with Homecare Solutions. We can just call you if we need any more tips.
Yes.
All right.
Yes,
Thank you so much,
absolutely.
Diane.
Thank you.
Great tips.